Yes, as part of Providence investment in behavioral health, one of the things that we have been working on is really looking at our local community and where our gaps of care exist. And in addition to that, we also have been participating in something that we call ED and Up, which is really looking at how we care for patients who come to our emergency department with a behavioral health need. And as we started to do that work, we found out, there are a lot of gaps for patients, not knowing where to go if they're out of their medications, for example, or when their symptoms begin. And we started to work with our community partners to address what those gaps are and see if we could leverage those services in our community and our partnerships. And it kept coming back that we actually have a gap in prescribers who are willing and able to prescribe medication management for patients in a bridging clinic. And so hence the behavioral health urgent care was born. So I think that this particular urgent care really serves our community because, again, it creates a safety net for patients where when they're in a crisis they know where to turn. And I think what we're seeing locally is that there's actually quite a bit of unmet need when it comes to behavioral health and substance use disorder treatment and services. So we're able to provide that gap protection for individuals in Snohomish County.
And it's really nice to be able to tell people, even when I see people in the clinic and they're leaving, hey, if you have a crisis, this is the place to go. And I see people's faces just light up like, wow, I don't have to go to the emergency department if I'm in a crisis. And so it really it feels good to be able to say that to people.
And I think even additionally for me, this is really also about reducing stigma and barriers. I think traditionally people have had a lot of stigma around accessing care, and this is one step in the right direction to move to a place where we've completely eliminated that.
I think it's important just to let people know that there is help out there and that it's never too late to come and get help, and that there is hope and that people do get better.